Bismillahirrahmanirrahim. In this video, I am going to tell you about systemic sclerosis, commonly known as scleroderma. It's a musculoskeletal and connective tissue disorder. In systemic sclerosis, there is a fibrosis which ultimately leads to degeneration and which affects skin, blood vessels, and internal organs such as lungs, heart, and kidneys. Scleroderma is basically an autoimmune disease. It affects the multiple systems of the body. It causes the functional and structural abnormalities of blood vessels, fibrosis of the skin and internal organs, which ultimately leads towards degeneration. There are some risk factors associated with the scleroderma. Can be due to environmental factors or due to genetic predisposition or defective immune system. Environmental risk factors are vinyl chloride, which is used in construction, which is used in making windows, silica dust, which is used in industries, rapeseed oil, and trichloroethylene, which is used in paints. And some drugs can also cause scleroderma, such as bleomycin. Now we are going to discuss about pathogenesis of scleroderma. As we have discussed earlier, if patient is exposed to any of the risk factors, they might develop this disease. There are basically three steps of pathogenesis. Firstly, there is vascular dysregulation, then there is immune dysregulation, and at the end, fibrosis occurs. As a result of vascular dysregulation, blood vessels are also affected, and there is an endothelial injury which causes intimal proliferation. Intima is basically the innermost layer of the vein or artery, which further causes vasoconstriction. As a result, hypoxia develops, and fibroblast activates as a result of degeneration, and collagen starts depositing in the body. Due to immune dysregulation, there is an antibody production, and B cell starts activating, which ultimately leads towards a fibroblast activation. Fibroblast synthesis increase the quantities of collagen type 1 and type 3. It further causes fibrosis in the skin and internal organs. Scleroderma is 4 times more common in females than males. There are two types of scleroderma. One is localized and other is systemic. Localized only affects skin, and in systemic, there is widespread inflammation all over the body. It affects the multiple systems of the body. This picture shows some clinical features of scleroderma, and limited symptoms are commonly known as CREST. Systemic sclerosis causes calcium deposition in the skin with the Raynaud's phenomenon and esophageal dysfunction, which further causes thickening and tightening of the skin on the fingers and hands. And there's dilation of capillaries in systemic sclerosis, which causes red marks on the surface of the skin. For the diagnosis of systemic sclerosis, we go for complete blood count, and as it is a multisystem disorder, so for the proper functioning of the kidney, we can check urea creatinine levels. We can also check autoantibodies, anti-nuclear factor antibodies, and anti-centromere antibodies. And if the symptoms are diffused, we can also check anti-SCL70. In radiological examination, we can go for chest X-rays. Can also use high-resolution CT scan to demonstrate the fibrotic lung involvement, and barium ingestion to confirm the impaired esophageal motility. And we can also opt for other investigations for gastrointestinal tract, lungs, renal, and cardiac system. As the patient shows multiple symptoms, so for the management, we go for a symptomatic treatment. No treatment has proven efficacy in reducing the skin fibrosis, but we can do regular exercises, and through skin lubricants, we may limit contractures. For the Raynaud's phenomena, we can give oral vasodilators such as calcium channel blockers, ACE inhibitors, and angiotensin receptor blockers. We can use nutritional supplements for malabsorption, and for the bacterial infections, we can use antibiotics, and proton pump inhibitors can be given for the esophageal symptoms. And as we have discussed earlier, that systemic sclerosis is an autoimmune disease, so we can also give immunosuppressants such as cyclophosphamide with the low dose of oral prednisolone. This was all about systemic sclerosis. I hope you understand the concept. Subscribe my channel for more information.